Hi everyone. For this post, we're to discuss trends in healthcare costs. A trend in healthcare cost is anything that drives change to the price required for treatment of patients. Examples of cost changing trends can be access to insurance, patient demographic change over time, prevalence and efficacy of new procedures, cultural bias towards or against a given healthcare procedure or model, and yes, even the prevalence of a global pandemic. I would like to discuss trends as they relate to healthcare payment. The most obvious payment concern for many is the most impactful with relation to everyday life is out-of-pocket expense. Those affected most heavily by that expense are the uninsured. According to the US Census Bureau, 8.6% of the American population in 2020, or around 28 million people, did not have any type of insurance at all. While we could extrapolate data to represent the connection between poverty level and underinsurance, I will streamline this data for the purposes of this discussion. A 2021 report by the Census Bureau indicates that the median income for Americans was $41,535. A similar 2022 report by Statista indicated that the average out-of-pocket per capita expense for Americans in 2020 was $1,181. That means that for the median earner in America, almost 3% of their yearly income was spent on healthcare. These numbers don't seem too damning on their face, right? Well, that's before we take into account the 11.4% of Americans living at or below the poverty line of $12,760 yearly income. That means that on average, more than 1/10 of all Americans were likely to spend at least 9.3% of their yearly income on healthcare costs alone. While I could spend many pages discussing the relationship between yearly income and out-of-pocket healthcare costs, the requirements of this assignment dictate that I move ahead to private individual insurance. Private health insurance is medical coverage purchased directly by an individual without contribution from any outside sources. This can be accomplished by utilizing tools such as the healthcare marketplace, which is maintained by the federal government, or any number of similar websites, or by contacting the insurance provider directly. Some forms of insurance are eligible for government subsidies that make health insurance less fiscally burdensome by offering tax incentives for the insured. Though a large variety of options exist for the privately insured, the onus is on the individual to find what best suits their needs and budget. As of 2020, again according to the US Census Bureau, 10.5% of Americans chose to privately purchase health care. As direct information on non-subsidized plans is not really readily available, I shall use the pricing data related to plans purchased through the ACA, the Affordable Care Act, and on healthcare.gov prior to subsidy to represent this category of insurance coverage. According to both eHealth and the Kaiser Family Foundation, or KFF, moving forward, the average cost for an ACA healthcare plan for single individual in 2020 was $456 a month, which comes out to $5,472 annually. Those same plans had an average of $4,364 deductible with an out-of-pocket limit cap, meaning most they could spend for a year, of $8,150. As with all healthcare plans, whether private or sponsored, a higher premium will decrease the deductible and significantly affect out-of-pocket expenses. While these numbers do seem daunting, myriad subsidies are offered to those individuals who qualify when utilizing ACA healthcare plans. As of 2020, any person who chose one of these plans and met at least 100% of the federal poverty rate, which means they made at least $12,760 a year, was eligible for subsidies. Persons falling below that income level qualify for a number of government assistance programs to further offset the high cost of healthcare insurance. I don't have enough time in this video to discuss the intricacies of how the ACA has impacted the United States populace, unfortunately, but I can say, strictly based on statistics, that the program has been overwhelmingly successful at its goal of helping insure a greater number of Americans. The healthcare marketplace went live in 2013. According to the Census Bureau, in 2013, 16.8% of Americans were entirely uninsured. Just a short 7 years later, that number was halved to only 8.6% uninsured in 2020. While we're nowhere near having a system that meets the needs of every American, the ACA was a huge leap forward in ensuring the good health of the American people. While the ACA has helped millions of Americans gain access to health care previously not available to them, an overwhelming majority of individuals in the U.S. still utilize employment-based health coverage. As of 2020, 54.4% of Americans still relied on their place of employment to subsidize their yearly health care premiums. The KFF found that average cost of annual employment-based health insurance in 2020 was $7,470, with employers paying on average about 83% of that. This left the employee to pay around $1,200 or about $106 a month for the rest of the year. The low cost associated with employment-based insurance is a huge benefit, but as with most things in our world, the devil's in the details. Employer-sponsored healthcare came into vogue during and immediately following World War II. With the signing of Executive Order 9250, President Roosevelt created the Office of Economic Stabilization. This executive order effectively froze wages in an effort to stabilize various industries and stop others from poaching employees at a time when the war effort needed every person it could get. This worked well for its intended purpose, however, it did have unintended consequences. Employers started offering better benefits, particularly healthcare compensation, to entice employees to change positions. This was further compounded in 1943 when the IRS made employment-based health insurance tax exempt. Effectively, this allows companies to use money that would have previously been allocated for wage increases instead for benefit offers, and also allow them to keep a much larger portion of that same money than if they just offered as wage increase. Unfortunately, in our current time, this has resulted in what economists call a job lock, or reluctance of an employee to change jobs despite being unsatisfied due to extenuating circumstances. This is compounded by the waiting periods as well as specific eligibility periods, both of which may cause an employee to go without insurance for an extended period of time upon changing employers. All of these circumstances, along with many others, contribute to a lack of perceived mobility for those with dependent family members or those that have chronic health conditions and require regular medication regimens. The final form of healthcare coverage that I'll touch upon in this discussion is government-sponsored, or what many call socialized healthcare. This refers to blanket programs paid for by taxes that offer healthcare for all citizens in a given country. While this term has been demonized by conservative politicians in our country, a brief look at the numbers would beg to differ. According to the World Bank and the World Health Organization, in 2019, the per capita government spending for healthcare for the United States was $10,921.01 per person. This placed the U.S. first in per capita healthcare spending, far above the most frequently referenced nations of Canada and the United Kingdom, who both utilize government-sponsored healthcare systems and have outcomes statistically at least on par with the United States. Canada ranked 13th on that list with an average per capita spending of $5,048.37 per year, while the UK was 18th with only $4,312.89 being spent per capita per year. The primary complaint about socialized healthcare is that taxes need to be increased in order to offset the cost of the government, and this is a very valid claim. I looked a bit further into that claim, though, in order to compare some real-world metrics for this discussion. What I found was that the average tax cost for a Canadian in 2020 was 30.9%, while for the Americans in 2020, the same year, the average tax cost was 22.6%. For the year of 2020, the median income for a single Canadian was $41,200, according to CBC News and the Canadian Federal Bureau of Statistics. We know that the Americans are close to that, so now we're going to do some quick napkin math. Since the median incomes of the US and Canada are so similar, again $41,535 for Americans and $41,200 for Canadians, I'll just focus on the round number of $41,000 annually for these calculations. At the aforementioned tax rates and without any special deductions, in 2020 the American would have paid $8,856 in taxes, while the Canadian would have paid $12,669 in taxes. This is a discrepancy of $3,813 saved for the American. However, the American must also factor in healthcare costs. The average American utilizing employment-coupled healthcare spent $1,270 on their portion of coverage in 2020, bringing the American's total up to $10,126 at year's end for the same benefits that the Canadian enjoys. But wait, there's more. Beyond coverage, the American paid an additional $1,181 out of pocket on average for healthcare after insurance costs. That now brings the American's total expenditure in taxes plus healthcare and out-of-pocket costs for 2020 to $11,307 compared to the Canadian's tax expenditure of $12,669. That's a difference of only $1,362 and also does not take into account access to preventative treatments, the possibility of sudden onset of severe illness, life-changing accidents, and of course the propensity of American healthcare companies to regularly refuse treatment suggested by doctors and deny claims at their discretion. Add to that the nearly doubled federal yearly cost per capita in the United States compared to Canada, and I simply can see no fiscal argument that is made in good faith against the implementation of socialized healthcare. So I believe that about wraps everything up this week. Thanks for listening, and hopefully some folks find the numbers behind all of this as interesting as I do. Have a great week, y'all.